Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM from Houston, Texas, and you are watching the COVID-19 pandemic world news. This is August 10, 2021. In this presentation, we are going to focus on Delta variant, the effectiveness of existing vaccines against the Delta variant. Many questions have been raised about how effective the vaccines are, why we need to continue to use masks and self-mitigation rules, and we're going to answer these questions during this presentation. As of August 10, 2021, more than 36.7 million people have been reported to have COVID positive tests here in the United States, accounting for 633,818 deaths. This is the world chart showing the number of new cases each day, and it is hovering around close to 700,000 new cases per day, and this is probably the third wave. Here we have the first wave, and this was sort of a second wave. And now we get the third wave, which is brought on by the Delta variant. As you recall, the Delta variant was originally detected in March of 2021 in India. From there, it has spread to more than 104 countries across the globe. The Delta wave has been experienced not only in Asia, but also in Europe, and now it is in full swing here in the United States. Now let's look at the number of new cases here in the United States. As we can see, we had the first wave here, then we had a summer bump. Following that, we had a mega second wave, at which time we had 300,000 new cases per day. And as we can see, now we have this Delta wave, which I call the wave 3, which has reached almost 130,000 new cases per day, and this is just the beginning of the Delta wave. As we can see, if we compare it to these waves, we still may have several weeks to go before it reaches a peak and a plateau before it begins to make a decline. So we are in the early phases of this third wave or the Delta wave here in the United States. That's an important factor to keep in mind, because this Delta wave may have significant effect on hospitalizations, illness, and deaths in the coming weeks. Now, if you look at the death rate, it is considerably lower compared to the magnitude of the rise in the number of new cases here in the United States. But nonetheless, the death rates have almost doubled since the middle of July, when they were hovering around less than 100. Here we have Florida, which is experiencing the highest number of cases related to the Delta wave. As we can see, the number of cases have far exceeded the second wave and the first wave we had during the pandemic last year. At the peak of the second wave, they were experiencing 20,000 new cases per day, but now Florida is experiencing almost 28,000 new cases per day in the last several days. Let's look at the death chart here, and the death chart clearly shows an increase in the number of deaths in Florida, which is approximately like 5 to 10 times bigger than what it was towards the end of July in Florida. Now let's look at the new cases here in the United Kingdom, which is a sort of 4 weeks ahead of the United States in terms of this Delta wave. At the beginning of June, the United Kingdom experienced a sharp rise in the number of cases, predominantly which were brought on by the Delta variant, and it peaked somewhere in the middle of July, and from then it has come down, and it is still trying to make a couple of new spikes here. So it may be few more weeks before it can reach a level that was before the Delta wave started. Keeping these things in mind, now let us focus our attention on the effectiveness of the vaccines, which is the main feature of this presentation, and see where we stand in terms of vaccines, how effective they were to begin with, how effective they are today, and how effective they will be in the coming months based on their history. As we can see, the Pfizer, BioNTech, Moderna, and Sputnik, they all had greater than 90% or 95% protection against the alpha variant, which was the original variant. Then the Novavax had 89%. Oxford, AstraZeneca, Johnson & Johnson had a similar 66 to 67% protection against the alpha variant. That is with reference to the original virus. However, with the arrival of the Delta wave, first in India, then in Europe, Middle East, and now here in the United States, the major concern is how effective are these vaccines against the Delta variant, which is a predominant variant not only in Europe but here also in the United States. See, in this chart, we are looking at the effectiveness of the 2 doses of Pfizer-BioNTech, for example, represented here in blue. In the original case, they were almost 95% effective, but overall, it has been shown that with the Delta variant, it is supposed to be 80 to 90% effective, but those numbers are dropping quite significantly. And we will look into that particular data. Similarly, here we have a study that was reported in Israel. They were looking at the effectiveness of the vaccines. Here's the first dose of vaccine, which provided almost 65% protection. With the second dose, the protection with the Pfizer-BioNTech was almost 95%. Hospitalizations in May and June were showing significant protection. And here is the study from UK, which showed that the effectiveness of the Pfizer-BioNTech vaccine against the Delta variant was in the range of 60%. But as we get more data collected and as we analyze more data, we begin to understand that the effectiveness of the vaccine against this Delta variant are much less than what we saw them initially when they were instituted, and it also decreases with time. Most important point of this presentation. Okay, Israel reported Pfizer COVID vaccine was only 39% effective against the Delta variant, but it still reduced dramatically the number of hospitalizations, number of patients with severe symptoms, and also reduced mortality. So those factors are significantly important. And as I mentioned, 2 doses of vaccine were quite effective in reducing the severe symptoms, preventing hospitalizations, and reducing mortality. There was a 88% effectiveness against hospitalization and 91% effectiveness against severe illness. So those are the benefits of vaccines despite their reduced efficacy in terms of preventing the infection as such. So majority of the patients, when they get infection after they have been vaccinated, have very mild or minimal symptoms. And here is a study that was done in England that showed a much slightly better results in terms of the Delta variant. Here's the Alpha variant, and let's take this Pfizer-BioNTech vaccine, which was 95% effective. In the Alpha variant, it was like little less than 90% effective, but with the more recent studies from Israel, we see a different picture. Here is the most important fact of this presentation. Israel looked at people who had received Pfizer-BioNTech vaccine. After 2 doses of Pfizer-BioNTech vaccine, they had 95% protection against the Alpha variant. The study was done between June and July. So those people who had vaccine in April had a 79% protection. However, those people who had the same vaccine in March, now we are going back 3 months, they had a 69% protection. And those people who had received a vaccine in February, it's almost like 4 months prior to this study, they had 44% protection. And those people who had received it in January, which is like 6 months from this study date, they had only 16% protection against the Delta variant. So the most important point I would like to drive in this presentation is that the vaccines are quite effective in reducing the infection. They are 95% protection against the alpha variant, ranging from 40 to 80% protection against the Delta variant 2 weeks after the second dose. But as we get farther and farther away from the dose, the effectiveness of the vaccine goes down. And that explains the reason why some of the important things we talk about, like masks and self-mitigation, are important, because the vaccines are effective at the beginning, but their effectiveness wears off with time and with different COVID variants. Based on this information, Germany and France, along with Israel, are already gearing up to give a booster dose in September and October because of a significant rise in the Delta variant, so that we can increase the immune response and increase the protection rate from what it is right now. So in conclusion, vaccines does not provide 100% protection. None of the vaccines, even in the research studies, did not provide 100% protection. Number two, they did provide 95% protection right 2 weeks after the second dose, but their effectiveness against the Delta variant has ranged between 41 to 80% based on the Israeli studies and the UK studies. Third point I would like to make here is with time, as we get further away from the second dose of the vaccine, protection against the virus, especially the Delta variant, is going to steadily decline. And in the Israel study, as I pointed out, it was down to 16% for those people who had received the vaccine in January. Now let's think about it. Most of us, like me, doctors, nurses, and healthcare workers and frontline workers, they all received their vaccine in the month of January and February. So their effectiveness in protecting themselves against this Delta variant is not 100%, it's not 95%, it is not 80%, it is not 50%, it's far less, like 16% based on the Israeli study. That raises a question: should all the healthcare professionals and the frontline workers be considering a booster shot if and when it is approved, so that you have a much better protection when you are dealing with highly infectious, rapidly spreading Delta variant filling up the hospital emergency rooms and intensive care units? In the meantime, what you can do, you should continue to use the self-mitigation guidelines, because the vaccines are not as effective as we think, given the time that has lapsed from the time we received the vaccine. And it is particularly so for the frontline workers who received the vaccine in the month of January, February, or March. Their ability to have protection against the virus, Delta variant, is considerably less compared to those who are receiving vaccine like last month. Next, if a booster dose is available, I will be in line to get the booster dose. Thank you so much for watching this presentation. I am Dr. NIK NIKAM from Houston, Texas, and please do subscribe to our YouTube channel, and we will see you next time.